First, I'm going to discuss a patient's interaction and then the ethical aspects of it. This is a case of a patient who had multiple health issues with skin problems, a draining device, and a Foley catheter. I was on my shift at the med-surg floor. I entered my patient's room, introduced myself, and started to assess him. However, when I proceeded to ask if I could assess his skin, he became defensive and stated that we did not have to do that and it was not going to make any difference. I proceeded to answer saying that I was sorry and that I had to do it per hospital's policy. The patient continued to have a defensive tone and stated that he did not have to do it if he didn't want to. To that, I answered, "You're right. I have to do it per policy, but if you refuse, you're entirely allowed to do so." I continued to educate the patient on the importance of his skin checks and encourage him to participate while stating that he can, of course, refuse the intervention and we can try it at a later time if that was okay for him. The ethical problem in this case is that by encouraging the patient's autonomy, he can have increasing problems with his skin and the drain and Foley can malfunction and cause harm. The ethical approach on this case was respecting the patient's autonomy and providing education with beneficence and non-maleficence. Utilitarianism was the moral theory utilized in this case, which states that the decision was influenced by expecting the greatest good. In this case, the greatest good is respecting the patient's autonomy while providing education, allowing informed decisions, and encouraging the patient's participation. In addition, the ethical making process utilized was the Curtin's 6-step model. The first step is perceiving a problem, which was the patient's refusal of care. The second step is identifying the ethical components, in this case, autonomy and non-maleficence. The third step is clarification. In this case, was presented by repeating what the patient said, but in other words. The fourth step is exploration of options. In this case, the two options are allowing refusals with and without education and encouragement. The fifth step is application of ethical theory. In this case, utilitarianism was applied. And the sixth and last step is resolution. In this case, providing education and allowing patients autonomy. Thank you.